very good afternoon to you all. This is Dr. Sthiti Das, Clinical and Radiation Oncologist, Apollo Cancer Hospitals, Bhubaneswar. I have been serving the state of Odisha for now about a period of 13 years. I did my post-graduation in Cuttack Cancer Center, followed by fellowship in high precision radiation at Delhi Fortis. After that, I worked as a consultant in a premier institute in Bhubaneswar, and now I have joined Apollo Cancer Hospital, Bhubaneswar, with a vision to take the fight against cancer to new frontiers and to redefine clinical benchmarks and outcomes. Apollo Cancer Center at Bhubaneswar brings together the brightest minds in all fields of surgical, medical and radiation oncology, coupled with high-end technologies and all recent advanced therapies to create a state-of-the-art comprehensive cancer center of international standards and catering to the common man of our state. So today's session is all about breast cancer. In today's session, first I will explain to you about what is breast cancer, risk factors, signs, symptoms, screening, diagnosis and treatment. In the later part of the session, I will bust some myths about breast cancer, and also I will take some frequently asked questions. So now let's begin with awareness about breast cancer. We all know October is being celebrated as the Breast Cancer Awareness Month to draw attention and support for the awareness of this so-called deadly disease, and also for early detection, treatment and palliative care of this disease. If you see the worldwide figures, the numbers of breast cancer new cases is around 1.58 million worldwide. Out of these, up to 5 lakh of deaths are due to breast cancer. Of these mortality rates, the maximum is seen in the middle income and low income group countries, India included. If you go for the statistics in India, every year we see 1.68 lakh new cases and mortality is around 80 to 90,000. So even though the incidence in Indian scenario is less than that of US, why is it so that the survival rates are very, very low? This is because in US, the standard of care, though high, the disease gets detected in early stages because of awareness about the disease. The survival rates in US is 5-year survival rates are 95%. That means if 100 women get breast cancer, 95 of these women will cross 5 years. But if you see the same in our country, it is a dismal 60%. So this is because of lack of awareness about the disease, a fear psychosis about the disease, social stigma, which doesn't allow the people to come to the doctor and tell their problems and get diagnosed at an early stage. So there arises the need of breast cancer awareness, where we hold intensive campaigns about breast cancer awareness so that people come to know about this disease. They come to know that early diagnosis and treatment and early stages can give us a survival rate of 95 to 100%. And hence breast cancer is curable. So coming to what is breast cancer. Cancer is an uncontrolled proliferation of the cells. As we know, the human body is made up of cells. So these cells, they multiply according to a protocol. They follow the genetic coding. They get divided. They perform their function. Then, according to regulation of the cell cycle, they die and they are then replaced by the healthy cells. So this is regulated by some genes present in the nucleus of the cell. So if this gene is getting mutated by some environmental factors or some genetic factors, then it causes a dysregulated expression and dysregulated behavior of the cells, and they become cancerous. Now these cancer cells keep on multiplying, they don't have cell death, they grow at the cost of the normal healthy cells, they form a tumor mass, and also they can spread to the other parts of the body through the lymph vessels. So coming to breast cancer, now this cancer, if it arises from the duct epithelial cells which line the duct through which the milk passes, it may be known as ductal carcinoma. If it arises from the cells of the lobules, it is known as lobular carcinoma. If this cancer can arise from the connective tissue, then it may be known as breast sarcoma. So these are the different varieties of cancers we see in breast. Most common of these is ductal carcinoma or invasive ductal carcinoma. So coming to the risk factors of breast cancer. They are divided into two. One is the non-modifiable risk factors and one is the modifiable risk factors. When we come to the non-modifiable risk factors, the first and foremost is gender. Being a female is definitely a risk factor, but that doesn't mean that males are immune to this disease. 1% of male population, they get breast cancer. Coming to age. Age is the second most important factor, and with increasing age, the risk of breast cancer also increases. Third is estrogen exposure. In estrogen exposure, we have to see the length of the reproductive cycle, 1, early menarche and late menopause. It increases the period of estrogen exposure in our body, so that actually contributes to increase in risk of getting cancer, breast cancer. Second is nulliparity. If a woman who's not getting pregnant her entire life, not having childbirth, and even if she has childbirth at a later age and after that she doesn't breastfeed, so these all factors contribute to estrogen exposure, and in turn they increase the risk of breast cancer. Third is a personal history of hyperplasia, atypical hyperplasia in the duct or in the lobules, or there may be in situ lobular, in situ ductal carcinoma. Family history. 5 to 10% of all breast cancers we see, they are familial, inherited. If you are having one first degree relative, your risk increases by 1.7%. But if you are having 2 or more first degree relatives having breast cancer, then your risk increases to 2.5%. Any administration of exogenous hormones like in hormone replacement therapy, or more than 5 years use of oral contraceptive pills, or use of diethylstilbestrol also add to the risk factor of getting cancer. Second is the modifiable risk factors. Now these are the factors which we can control. One of first is a diet, fatty diet, obesity, lack of physical activity, smoking, alcohol, stress. All of these factors contribute increased risk of getting breast cancer. Now coming to the signs and symptoms. We all know that a breast lump is the first and foremost sign of breast cancer. But let me be candid with you that 90% of these breast lumps which we encounter in our daily practice are benign. They may be a cyst or a fibroadenoma which may change its size, appearance and texture as per your monthly periodic cycles. So the most important signs and symptoms which warrant attention are lump in the breast or the armpit, mostly painless. Second is change in size, shape and appearance of the breast. Third is a nipple inversion, nipple discharge. Eczema of the skin of the areola or crusting, scaling of the nipple area. Puckering of the skin of the breast, which is most commonly known as peau d'orange, associated with redness and inflammation. These are some of the signs and symptoms where we need to be alert and aware and visit our nearest doctor. Now coming to screening and diagnosis. Screening is a test which is done before the commencement of signs and symptoms of the disease. So for breast cancer, we have specific guidelines. These screening recommendations, which I'll be enumerating now, are applicable to the average risk population. So coming to the first one. First one is breast self-awareness. Second one is clinical breast examination. Third is a mammography. First, breast self-awareness. What is breast self-awareness or breast self-examination? Now this is an examination, or this is a most important tool which is in your hands and which can be done in the privacy and comfort of your own home, wherein you can palpate your breast, your underarm area and your neck area once in a month starting from the age of 20. The positions you generally use is a upright posture and a flat posture. You use the first 3 fingers. The middle portion of these 3 fingers are used to palpate each quadrant of the breast, the armpits and the neck. The idea behind is to get familiar to your own breast tissue, the consistency of it, so that even the slightest change may alert you and you may visit the nearest doctor for an evaluation. Second is a clinical breast examination. Clinical breast examination is done in a hospital by a doctor. The recommendations of the American Cancer Society and breast surgeons is from age 20 to 39 years. Once in 3 years, a clinical breast examination is recommended. After reaching the age of 40, you have to do an annual clinical breast examination. Now, third test is a mammography. Now, mammography is a sophisticated type of X-ray of the breast where we can actually diagnose very small tumors and microcalcification in the breast. Mammographic recommendations for the average risk female is up to the age of 40 years, we can do it as per the recommendations of the doctor. After the age of 40 years, once in a year. Once we reach 55 years, it may be done once in 2 years. Now these 3 screening recommendations are for the average risk population. What is the high risk population? Now there are some individuals who have a high risk of getting breast cancer. These are the individuals who have a genetic mutation which is most commonly known as BRCA1 and BRCA2. Presence of even any one of this gene adds up your risk of getting breast cancer by 60%. Any individual who has a family history like your mother or your sister, your grandmother has breast cancer is also taken up as a high risk individual. Third is a personal history of any hyperplastic like ductal hyperplasia or lobular hyperplasia disease or in situ cancers. So these high risk individuals, mammography recommendations are from the age of 30 years, and there has to be more frequent clinical breast examinations by the doctor starting from 30 years every year, along with breast MRI also. So coming to the diagnosis part. So once we see there is a lump, then there is a mammography done. So in mammography, there is a Birade's scoring system where we see whether the lump is actually benign or more suspicious of being a cancer. After this, if we see that the lump present in the breast is cancerous or there is a high suspicion of being cancerous, we advise for a biopsy test. Now, biopsy test is done as an OPD procedure by a surgeon where a chunk of tissue is removed from the lump to study it under the microscope by a pathologist. After this, the pathologist gives a diagnosis of cancer. Once this diagnosis is made, the other tests or metastatic workup of the patient is done to see whether the disease is localized or the disease has spread to the other parts of the body. This is most commonly known as staging of the disease. As we all know, there are 4 stages stage 1, stage 2, stage 3 and stage 4. Stage 1 and stage 2 is early stage where the disease is restricted to the breast area. In stage 3, it may go to the lymph nodes in the axilla or the armpit. In stage 4, this disease may spread to other parts of the body, most commonly to bones, brain, liver or lungs. Now, staging is an important tool for prognostication as well as treatment planning. Prognostication because stage 1 and stage 2 disease, if treated properly, have a cure rate of around 90 to 95%. In stage 3, it drops down to 70%, and in stage 4, it drops down to around 40 to 50%. So once the staging is done, the treatment plan is decided. Now the treatment plan is decided by a comprehensive team of multidisciplinary doctors who are medical oncologists, surgical oncologists, radiation oncologists, radiologists and pathologists. The whole team then discusses and decides about the best plan of treatment for the particular patient. Now coming to the treatment aspect. First is surgery. As we all know, surgery is the mainstay of treatment. For early stage, as surgical procedures have evolved from grossly debilitating surgeries to more sophisticated procedures where the aesthetic satisfaction of the patient is also taken into account, and oncology safety is also regarded by most breast surgeons so that breast conservation surgery can be done along with a good clinical outcome. So for early breast cancer, usually we go for a lumpectomy and breast conservation, and after that radiotherapy is mandatory in these cases. Mastectomy or modified radical mastectomy is also done for some patients where the breast is fully removed. But there are many more oncological practices where help us to reconstruct the breast. Now, second therapy is chemotherapy. Chemotherapy is given in 3 ways. One is the neoadjuvant approach, where if there is advanced cancer, we can give it before surgery to downstage and consolidate the tumor. Most commonly it is given in the adjuvant setting where the surgery has been done, and then chemotherapy 6 or 8 cycles is given based upon the histopathological report. Third is a palliative setting or in the metastatic setting where the disease is in stage 4 and chemotherapy is given to consolidate the disease. This chemotherapy is given via injections and it is a systemic therapy. Third is radiation therapy. Now, radiation therapy in breast conservation surgery is a mandatory procedure where we use high energy X-rays to treat the microscopic disease in the tumor bed as well as the whole of the breast. Even after mastectomy, if it is a node positive disease, radiotherapy is indicated. It is also given in palliative settings where the cancer has spread to the brain and the bone. So radiation with such high-end techniques at our center with intensity modulation and image guidance are used where we can treat the tumor completely without side effects or with negligible side effects. So coming to targeted therapy, this is another molecular targeted therapy which is similar to chemotherapy, but it is better than chemotherapy because it has very less side effects. It is targeted to breast cancer cells which are Herceptin positive, and they act upon the breast cancer cells only. Coming to hormone therapy, this is also another therapy where breast cancer which is positive for estrogen receptors and progesterone receptors, we can give hormone therapies to such patients after your completion of surgery, radiotherapy and chemotherapy for a period of 5 to 10 years. So we have a big armamentarium of weapons to treat this disease, and let me say, breast cancer is curable. Early detection is actually the key to increased survival. So now I will bust some myths about breast cancer. First is the most common myth we face in our daily practice is cancer is contagious. Let me tell you that cancer is not contagious, it does not spread from one person to another. Myth 2, you can't get breast cancer if there is no family history. This is not correct. Breast cancer can happen to anyone. In fact, as per statistics, any breast cancer which we encounter, in 70% of these cases, there is no identifiable risk factors. Diet and lifestyle doesn't affect your risk of breast cancer. A fatty diet, alcohol, smoking, lack of physical activity, they all contribute to the risk of getting breast cancer. Fourth, young women don't get breast cancer. It is true that with increasing age, our susceptibility to breast cancer increases, but we have seen young patients at the age of 20 years also who have got breast cancer. Only visible sign of breast cancer is breast lump. No, there may be also a nipple discharge, a nipple invasion, then there may be a scaliness of the nipple areolar complex, there may be a generalized swelling with redness, inflammation of the breast. Painful lump can be breast cancer. No, clinically if you see, and the most important reason why we miss these lumps are because these are painless. Most lumps which we encounter and which come as cancer or breast cancer, they are painless. In later stages, they become painful. Testing positive for BRCA1 or BRCA2 gene means you will surely get breast cancer. Getting BRCA1 or BRCA2 gene surely increases your risk to about 60%, but that doesn't mean that surely you will get breast cancer. Radiation by mammography causes breast cancer. Studies have shown that the radiation by mammography is not very harmful and there is a very minimal risk, but the benefits are so many for early detection and treatment that it clearly outweighs the risk of radiation. Injury to the breast can cause breast cancer. Sometimes if there is an injury to the breast, we see there is a formation of a lump, but that is always a benign fibrotic lump. It is not breast cancer. Most common question I see in my daily practice is patients tell that if we do a biopsy, that will lead to the spread of breast cancer. But breast cancer and doing a biopsy have no relation. Nonetheless, if you do a breast biopsy, you come to know the disease at an early stage. Coming to some frequently asked questions about breast cancer. First is, can I decrease my chances or risk of breast cancer? Yes, definitely. Some of the modifiable risk factors, which like a diet, a balanced diet with lots of fruits and vegetables, maintaining a healthy weight, physical activity, controlling the stress levels, and minimizing alcohol and smoking can help us to reduce the risk of breast cancer. Can I prevent breast cancer? To some extent, for high-risk individuals, there is a method. One is chemoprevention. By use of medicines like tamoxifen, raloxifene, we can prevent our chances of getting breast cancer. Surgical options like prophylactic mastectomy, prophylactic oophorectomy. In these conditions where high-risk individuals have a very high risk of getting breast cancer, they meet their doctor and then they discuss the risk and benefits of chemoprevention and surgical prevention. Third is, if I am diagnosed with advanced cancer, that means it is the end of the road. No, let me be frank with you that even though we see most cases in advanced stages, still then treatment options are available and there are many patients who respond to this treatment, and we can also offer them good quality of life with increased overall and progression-free survival even up to 2 to 3 years. Is surgery the only treatment and other therapies which are advised to us like chemotherapy, radiation therapy are optional and non-essential? No. All treatment which we advise to you, though surgery is important, but chemotherapy, radiotherapy and other therapies like hormone and targeted therapies are equally important. Now these protocols or this treatment is based on evidence based, and therefore all this treatment help us to increase our overall survival and progression free survival. So all this treatment are important and they should not be neglected at any point of time. Will there be severe or crippling permanent side effects of the treatment? No. As oncology is advanced, till date, whatever patients we are taking for treatment, need be surgery, chemotherapy or radiotherapy or any other therapy, there are no such severe permanent crippling side effects. Some side effects we can expect, but they are conservatively managed by medications and patients can complete treatment comfortably. So I will end this session by telling that breast cancer is completely curable if we detect it early enough in the early stages of the disease and we follow a proper treatment plan by a comprehensive cancer center where all the oncologists starting from surgical, radiation, medical oncologists are available, and we do a proper follow-up even after completion of treatment.